In this lesson, we're going to take a look at SBAR communication. When we talk about SBAR, what are we talking about? So SBAR, it's a communication method. It's meant to be efficient between healthcare providers. It provides the most pertinent information, the most basic. And the reason we have SBAR is because if there were no sort of process in order to communicate this information, it could slow down care. It could translate to misinformation. By using SBAR, you actually improve the communication process. There's a really funny patient story attached to this lesson, so go check it out because it talks about SBAR and why we need it. SBAR stands for Situation, Background, Assessment, and Recommendations. So the S in SBAR stands for situation. What it does is it looks at the situation of the patient and it finds out what's actually going on with the patient. When you put it in report, be objective. You want to identify the patient. So this would look something like if a patient was complaining of chest pain, you would say patient is complaining of chest pain. I'm using a bunch of abbreviations. States 8 out of 10 pain. It's chest pain. It's crushing and it radiates to the left arm. We would call this a left upper extremity, the left arm. So this tells us the presenting issue with the patient, specifically about what's going on. B stands for background. The main point of this is to give a brief medical history. It tells us why they're here, any primary diagnosis or chief complaint. It also covers any labs, code status, so you'll get a full code, and recent hemoglobin of 10. This is just an example. It can also help provide insights of medical history. You could say history of congestive heart failure. But this gives us an idea into the background of the patient. It also has the most recent vital signs. A in SBAR is for assessment. This is part of the SBAR where you look at what we think the problem is. It also looks at the nursing diagnosis. There's a great lesson on nursing diagnosis, so go check that out if you haven't seen it. But this is basically analyzing the situation as to what's going on, what's wrong with the patient, or what we suspect is wrong. We don't want to make a medical diagnosis here. We don't want to do that. The other thing you're going to want to do here is include your own assessment or your own assessment findings to back up why you think it's whatever's wrong is going on. The R in SBAR is for recommendations. This is the point in the process you're going to want to make recommendations on what you think should happen. So if we go back to our patient with chest pain, so probably need an EKG. We'll probably need maybe a troponin or some other cardiac markers, maybe a full set of labs like a basic metabolic panel, maybe some chest x-rays. These are all things that we think should happen. What interventions should we anticipate are going to be ordered? Does the doctor need to come to bedside to see the patient? These are things that we recommend to our other healthcare providers so that we can actually advocate for our patient. There are multiple times when you're going to use SBAR, and knowing when to use these things is really, really confusing. It can be extremely intimidating. So knowing this will create a better foundation for you when you need to use it. So here's some examples. So you can use it when you are giving report to or from the operating room nurse. Another example would be a transfer to another facility, like a skilled nursing facility. Another one would be to maybe another unit, potentially like a low level of care. So think like ICU to the floor. So another time that you'll use SBAR, but not necessarily in a formal report, is when you're calling a physician with a new problem. If your patient has a new complaint, for example, the patient with chest pain, you'll use SBAR format to talk to the doctor and give them the new complaint. SBAR gives you great structure in knowing what to say and how to say it so that you're very succinct. So I'm going to give you an example. So listen closely. Hey, Dr. Smith, this is a nurse caring for Miss Johnson. She's in room 2. She has a new complaint of chest pain. So the chest pain is radiating to the left arm and jaw. She presented yesterday for exacerbation of congestive heart failure. She has a new or a history of coronary artery disease. Her telemonitor is showing ST segment elevation. Heart rate is 110. Blood pressure is 185 over 115. I'm suspecting an MI, but I need to confirm with an EKG. Would you like to get some cardiac markers, maybe a 12-lead EKG? And could you come and see the patient? That example is a succinct example of exactly what you would need to say to the doctor. It sounds like a mouthful. And a lot of times it's going to be conversational, but just remember that this is the format that you want to get it delivered to. You also want to make sure that your information that you give to the doctor is recent. You want to make sure that you're not struggling to go get a new set of vitals. Make sure you have all that information up front. The other time you'll actually use SBAR format is maybe giving an update to a charge nurse or a physician. Like if the doctor comes by, how's Miss Johnson with the chest pain? Oh, she's doing much better after she got the nitro. That's a good example. Nursing concepts for this lesson are communication and teamwork and collaboration. Okay, let's recap. Situation. It's about what's going on with the patient. Also be sure to identify your patient. Background tells a brief medical history. So be sure to include your recent labs, any vitals, any pertinent information. Assessment. What do you think is going on with the patient? Speak your mind with your recommendations and make sure you advocate for your patient. What do you think should happen? And then know when to use SBAR and know when to use SBAR format so that you can communicate effectively with those other healthcare providers around you. That's all for the lesson for SBAR. Make sure you check out all the resources attached to this lesson. Now go out and be your best selves today. And as always, happy nursing.